It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Welcome everyone, and we're continuing to give you good health news. Sometimes we talk about specific things that Lehigh Valley Health Network has been offering here in the greater Hazleton area. But today we're going to talk about something that's special. Now, God forbid something should happen. You fall, you think you broke your arm, your wrist, you did something to your wrist, your leg, your ankle, or whatever. You need a good orthopedic surgeon. And we have been very fortunate that we have the best here in Hazleton. And today we have two of them here, no stranger to the show, Dr. Tom Meade and Dr. Marcos Martinez. And they're part of the new LVPG Orthopedics and Sports Medicine group here, and they're located at a beautiful location, a state-of-the-art. It's at 26 Station Circle, Humboldt. Nice to have you two doctors on.
Thank you.
Of course, he's no stranger to television here. He's, Mr. Dr. Meade show. He did great. Tom, as I said, you're no stranger to the area. You've been here many, many years. Why did coordinated health become a part of LVHN?
So I think it's the inevitable consolidation of healthcare that's happening across the country. I mean, when I first started practicing 30 years ago, private practice was a big thing. Orthopedics was basically a group of mom and pop groups, 2, 3, 4, 5 groups. But coordinated health, with the help of Dr. DiOrio, over the years grew to a very powerful regional musculoskeletal group. And actually, after I joined them, this was an area that was very important to me. So we expanded up into this area, right up the whole Carbon County, Luzerne County in this area. We opened up an office in Lehigh, hometown, Hazleton, and so this was a very important area for us. And then, of course, Lehigh Valley became an important presence up here with the Hazleton General Hospital. They did an awesome job. So really it was just inevitable, and it made enormous amount of sense. They had important subspecialties up here. They had some orthopedics, but we had the whole breadth of orthopedic subspecialties. So it was pretty exciting and almost a natural evolution for us to come together. So it just made sense, and finally it did come together. I guess it was about 18 months ago, Marcos, and it's been really a tremendous, mutually beneficial experience for the past 18 months.
So now you're a part of the LVPG group up here.
We're part of the LVPG group, correct.
And the both of you are working out of the Humboldt area.
Great facility. You can see it from 81. Great location, state of the art.
Tell me about the place.
So, well, it's great actually. I helped design that a couple years ago, and it's really state of the art. It has imaging center, has physical therapy. It has almost every subspecialty in orthopedics offered. We have sports medicine, we have physiatry, we have pain management, we have spine, we have hand, we have foot, and eventually we have the potential to expand into surgical suites too. So it's not only what we're doing now, but we're actually looking to the future. So we have almost every specialty you can offer right now. It has great access, great parking, great hours, and it has potential expansion into the future.
What are some of the common surgeries that you perform?
So I'm pretty boring.
I know.
I'm pretty boring, but it's great. What the advantage I guess I had over the years when we started, I could do a little bit of everything, but I think I was able 15 or 16 years ago to just sort of focus on one area that I like, which are basically knees. So I do knee problems, from all ages. So I basically do a lot of knee replacement surgery. I do some sports medicine, ligament reconstruction, but Dr. Martinez does a lot of sports medicine, shoulder, knees, etc.
For the last 30 years,
yes.
Okay, I don't know how many years I know you, it has to go be back 20, 25 years, okay. you've seen a lot of innovations
Yes.
in knee surgeries,
Yes.
as well as we'll talk to you, Dr.
Yes.
Martinez. What are some of the things, the new innovations now in joint replacements?
So it's always a moving landscape, but it's pretty exciting. And I think if I had to categorize some of the top 2 or 3 innovations in what I've seen over the past couple decades, is the evolution of major surgery being refined and simplified to allow us to do it as outpatients. These were major surgeries we're doing as an inpatient. We do literally 90% of our knee replacements go home the same morning. 30 years ago, this was unheard of. You're in hospital for 7 days. So I think outpatient surgery. Number 2, non-narcotic or minimal narcotic pain management, multimodal pain management. So we couldn't send people home unless we could figure out how to control the pain. So that was probably one of the biggest advantages. And I think in the future, orthobiologics will be very important. Robotics is going to be important. So there's a lot of things on the landscape, but those are probably some of the top 3 or 4 innovations.
The interesting thing is I watched the show that you did, and you had some of your patients doing testimonials. Okay,
Yeah.
and that's always tells the case,
Yeah.
and how they recovered, and they were very pleased with the fact that they were home the same day, and the therapy that they received.
Well, especially in the pandemic. See, there was this aversion to hospitals during the pandemic. So it was really almost a fortuitous happening where patients really didn't want to be in a hospital. And really most orthopedic patients, elective surgery that we do, they're not sick. Right. These are healthy people that have sore joints.
Yes.
Or a sore problem.
Yes.
So really we should be able to figure out how to treat these patients, the majority of them, as an outpatient, get them home, and not have any of the intrinsic complications that can occur with longer stays in the hospital.
And my friends, like I said, they got the best surgeons right here in Hazleton at the Lehigh Valley Physician Group there at the Humboldt Industrial Park. It's a beautiful building. And I'm thrilled, Tom and Dr. Martinez, that we have, not only you, we'll talk about the other orthopedic surgeons we have up here in the PAs, the advancement in healthcare in terms of orthopedics that really are just blossoming in this area. What do you think, Tom?
Oh, it's. I think this is a very important region for Pennsylvania. Literally, we're part of the Wyoming Valley, which is really the 4th largest metro area in the state. After Pittsburgh, Philadelphia, and the Wyoming Valley. So it really is a pleasure to bring high-quality, fellowship-trained orthopedics to this area. Because that's really how orthopedics is regional. People should be able to get good care where they live. And that's what Dr. Martinez brings here. That's what our whole team brings here. So that's what we're excited about.
My good friend, Dr. Martinez, we're going to talk to him right after this break. Welcome back to the Sam Lesante Show. Folks, remember 24/7, SSPTV.com, and our YouTube channel. Just search Samson Productions. We have people watching us from all over the world. We had someone who sent me a beautiful letter from China. We have someone in Paris. We have, Bolivia. It's amazing how many people are watching our shows, and I appreciate that very much. Speaking of these great shows, these are health shows, and they're brought to you by the Lehigh Valley Health Network in Hazleton. We're talking about the new orthopedics group, the LVPG group. It's Orthopedics and Sports Medicine, Humboldt Industrial Park. It's beautiful. It's right off the interstate. Now I'd like to introduce to you, maybe many of you know him, Dr. Marcus Martinez. Tell me about you, okay? You were born in Puerto Rico, right? Then tell me where you went and what you did.
Yeah, so I was born in Puerto Rico, and very early in my life, we moved to Florida. So basically was raised in Florida, and I went to University of Florida for undergraduate. And eventually I came to the Northeast in New Jersey, Rutgers, to do my medical school training, and as well as my orthopedic training at New Brunswick, New Jersey, at Robert Wood Johnson.
Why'd you go into orthopedics?
So during my college years, I did a lot of sports medicine at University of Florida. I did athletic training, so I helped out the football team and a bunch of different sports there, and that's where really my interest in medicine, but really interest in sports with medicine came, and I just throughout the years, I always just came back to that.
Right into orthopedic.
Right.
We're not going to downplay the sports medicine because I found this interesting. Tell us who you work with and the teams that you work with.
So after I finished residency, I went to a fellowship in Texas, the Texas Medical Center, where Baylor College of Medicine and University of Houston. And there I got to work with all the professional teams. So the Houston Texans, the Rockets, the Dynamo, which is the soccer team, and the Houston Astros. So for a year, I was able to get that experience, and that was a very good experience that we had. And eventually, as I moved here and I got a job at the Coordinate Health, we helped out the Lehigh Valley Phantoms, or the AAA hockey team here in Allentown. For 3 years, I did that. So, I've had some extensive experience with sports and high-level sports. So, it's something that from the beginning I've liked and like to continue doing it for my career.
Dr. Meade talked about the Lehigh Valley Health Network and how great it is to be working for them.
Yeah.
What made you decide to come and work for the Lehigh Valley Health Network?
Well, it was a merger between Coordinate Health and Lehigh Valley Network. And like Dr. Meade said before, I think it was just something that inevitably was going to happen. And so far, everything has been great. We've had the infrastructure of the network and the different specialties, so that helps us give patients a better experience and things that we can't provide here in Hazleton. And so far, management and the patients and Hazleton itself has been a great experience. So,
what services do you provide?
So mostly, orthopedic. I do general orthopedics, but emphasizing sports medicine. Mostly arthroscopic, shoulder, rotator cuff repairs, ACL reconstructions. But I also do some knee replacements. I do fracture care.
You're getting into his territory. I realize.
No, I will never get there. But it's a little bit of everything.
Yeah.
Mostly specialized in
sports. The interesting thing, as I mentioned, you don't know when something's going to happen to you. God forbid something happens, you fall, and you know something's wrong, and they tell you need an orthopedic surgeon. And it's great, it's fabulous to have this group right in our backyard up here at Humboldt Station, the Humboldt Industrial Park, and have all of these doctors. And we'll talk about how many doctors are there. So what are some of the common injuries that you see?
Probably the most common thing I see is shoulder pain. So that's where your rotator cuff injuries. So I do a lot of rotator cuff repairs, but we also see a lot of knee pain, osteoarthritis. I'm the team physician for now Penn State Hazleton, as well as the Hazleton School District. Yeah. So we're starting to see a lot more of those young athletes getting injured, and that's where the ligament injuries come in, and meniscal injuries. So it's right now it's a big gamut from young athletes to older people in pain.
So you have people, and we talked about this many times, Tom, was that people have knee problems and they wait and they wait and they wait, not realizing that they should get it done as soon as it's necessary to get it done. In your case, when somebody's having shoulder pain or whatever, the phone number is on the screen, they should address that soon, right?
Definitely. I mean, there's things that we can take care of quickly and not let things get too ahead, and we're dealing with more salvage procedures at that point. So, if you're having shoulder pain, you should come by and we can get checked and see if there's something that we can, quickly get done so that it can benefit and not get to the point where we're doing more aggressive procedures, for sure.
In terms of recovery, we talked about knee surgery. Now you're in, and sometime you're out in the same morning, which is unbelievable. How's that? How advanced are we in your sports medicine area?
Yeah, I mean, most of my surgeries are outpatient, so most of these patients are going home the same day. And like what Dr. Meade was talking about with the new multimodal pain control, by using different type of pain medications, people are able to go home and be comfortable and not have to be readmitted and given more narcotic medication. So, we've learned a lot these past few years, and that's something that we both really are, want to address the situation, making sure that this pandemic of opioid abuse is obliterated and provide our patients with good pain control.
How do you like working with Lehigh Valley Health Network?
No, I mean, so far I've enjoyed it. It's only been about maybe a little less than a year that I've been with Lehigh Valley Network, and they've been very, very receptive to all the things that we need, and you know, I just see, you know, a good future ahead of us and taking care of the population.
I think what they have done in the last number of years in this area, and for that matter in the entire network, has been unbelievable.
Yeah, they've invested a lot.
They've invested a lot back into community, and they're going and getting doctors like you, okay, and doctors like Dr. Mead. I mean, it's top shelf, okay. In terms of the area, how do you like the area?
You know, it's something new for sure.
Yeah.
You know, down from the south and more beach area, but I'm really enjoying being up in this area and seeing the mountains. I love my ride to work.
Yeah.
You know, I've seen different seasons, and the people are great. I mean, really appreciative.
Yeah.
So you know, I'm enjoying being
glad
here.
you are. Yeah, we hear a lot of great things about what's happening up in the area. Folks, I'm talking to Doctors Mead and Martinez. They belong to the orthopedic group, fabulous group. They're there to help you. The phone number is on the screen. We come back, we'll talk a little bit about insurances and some other interesting facts about healthcare. Stay with us. Welcome back to the Sam Lesante Show, folks. The healthcare shows are brought to you by the Lehigh Valley Health Network, Hazleton. We have two orthopedic doctors on the show today telling us a lot. Doctors Mead and Martinez. Now, in the group, which is, the place is fabulous. I mean, this on 26 Station Circle, Humboldt. Phone numbers on the screen to call for appointments. You have other orthopedic doctors there. Who are they?
We do. We have a hand surgeon, a specialist hand surgeon, who's Dr. David Nena. We have another sports medicine specialist. Her name is Dr. Lisa O'Brien. And then we have a total joint specialist. His name is Dr. Christopher Samouj.
Yeah. Great number of doctors, orthopedic doctors.
Yeah, we spanned all the different types of specialties, so we can take care of any orthopedic.
Covers it all.
Yeah.
Covers it all. Speaking of value, Tom, you know, you're talking about the value of this healthcare network. It just brings a lot to the table.
Well, I look back, you know, Sam, I moved here after my residency and my fellowship because of Lehigh Valley Healthcare Network. It was a great trauma center, but it was really centered down in Allentown, and that's sort of why I came back, because I did my internship there after going back to Jefferson Rothman Institute. But since then, the medicine has changed, and they've changed with it. So for us to really be able to take advantage of all the assets they have, you know, we're strong in orthopedics, but when we need you need resources, you know, to expand and get in every other community. Just look what Lehigh Valley is doing. That's exciting. We just opened up a new hospital in Hecktown Oaks on the other side of the Lehigh Valley. We're building a hospital in Lehigh, right down the road. So we're going to be able to expand that Hazleton market south past Tamaqua into Lehigh. You know, I grew up in Mountaintop. I lived there. Very few people know that until I was 4 or 5. Then I moved to Pittston. Well, now we're up in that area. And so there's a lot of people that come from Mountaintop, Nanticoke, Berwick, that area. They lean more up into the Wilkes-Barre. We're building a hospital in Scranton. So if we need any specialists and they're up in that area, they have families up in that area, because that's really what we treat. So that's the advantage of being part of the Lehigh Valley Healthcare Network. So the value is tremendous. And again, if we need patients come in that we treat, they need a cardiologist, they need a neurologist, they need all sorts of specialists, neurologists. Now we have all of the breadth and depth of those specialties at our fingertips. So you just feel so much more complete as a physician that we could utilize all of our colleagues and the different specialties. That's sort of the exciting part.
You know, it's interesting, Dr. Martinez, and what he's talking about is that many years ago, God forbid you need an orthopedic surgeon, you had to go out of town. You had to go to Allentown, or you had to go to Philadelphia, whatever. It's so good to know, and I hope people don't need them, but however, it's so good to know that we have this orthopedic group right here in Hazleton, right here at LVPG, the Lehigh Valley Physician Group, with all these experienced doctors right in our own backyard. Now, I want you to also know, folks, how do you pay for these things? They accept mostly all insurances, and now they're taking Geisinger Gold. So I know there's a number of times people have come up to me and asked about, how do I get in touch with Dr. Mead? I have a problem with my knee, or how do I get in touch with etc. And the first thing is, what kind of insurance do they take? Well, now I think we'll sort of cover the gamut. I don't know if there's anything that you guys do not take,
So Sam, people want to pick their own physician.
Yes.
And it's always frustrating for a patient whose wife or husband or significant other has the insurance, and they say, but I want this physician. That's the other value of being involved with Lehigh Valley. They negotiate with virtually every major insurance carrier, including Geisinger. So it's so exciting. So the patients of the Hazleton area don't have to worry about, in general, they cover basically every insurance product out there.
Tom, with years of experience, and Dr. Martinez, looking at, we talked about Lehigh Valley Health Network, okay? We had Brian on the show, Brian Nestor, who is a fabulous person. You could see the foresight and how they're concerned about healthcare. Isn't it great to be, associated with Lehigh Valley, the PG group?
Well, it's like a major league sports team. We just went from a specialty minor league team, and we're able to join the big leagues from all over. We were in the big leagues in orthopedics, but we could only go, so far. It's kind of like, we have the Olympic team of healthcare right now. So it's really one of the most recognized healthcare networks in the country for what they've done, historically.
So when you studied the area and you just studied, making the move to Lehigh Valley Health Network, I know when businesses come into the area, they look at healthcare, they look at education, they look at, community activities. You were pleased with what you saw, correct?
Yeah, I think it's a great place, especially to raise a family. Like you said, good school districts, a lot of things to do, outdoor, indoor, dining, good health networks, businesses. I found these past, I believe I've been here 5 years now, 5 or 6 years, that everything that I would want is here in the valley.
Coming from the areas you came from, big cities, and you worked in, a lot of times, and we've sort of limited this thinking many years ago, you got to go out of town, Tom, the old thinking of, if you want a good doctor. Now it's the reverse. We have experienced doctors here that you're going to get maybe better than in some of the major cities, okay? Because sometimes you're dealing with interns in those major cities, but here you're dealing with people like you and your team and Dr. Mead. I think that's so rewarding for this area. When you think,
and plus you don't have to, you can stay in your hometown and recover in your hometown. It's a big thing versus having to go, hours away. So.
The terms, Tom, of your fellow orthopedic surgeons, you know these people that you've worked with, and how do you find them?
So, they're consummate professionals. They're all well trained. They're all board certified. And that's the key. So before either Coordinated Health or Lehigh Valley hires these people, that's the bar that they set. You can go around the country and you can practice orthopedics without being board certified and having other credentials. But Lehigh Valley Hospital Network, if you look at the awards that they have as a hospital, it's really phenomenal. They're a magnet hospital from a nursing standpoint. They're always in U.S. News and World Reports. But even the physicians are top class. They have some of the best training in the country at schools like Baylor and fellowship trains and et cetera. So it's really it's like a gold mine working from a talent standpoint at Lehigh Valley.
Well, I'm very excited about what we have here. Our thanks to Lehigh Valley Health Network. And remember, it's the Lehigh Valley Physician Group, Orthopedics and Sports Medicine. Phone number's on the screen. If you have any questions, any pains, etc., give that number a call. I want to thank you for coming back on the show.
Thank you for having me.
Nice to have you. And of course, my good buddy Tom Mead has been around for a while. We watch your show all the time. I find it very educational. It's not as popular as the Sam Lesante show, but it's okay.
Never. Thanks, Sam.
Folks, remember, if you need health care, you got it right here in your backyard at Hazleton. It's the best. We'll see you next time.